Now, one state lawmaker is making a big promise: reduce deaths among those with a serious mental illness. Senator Catherine Miranda is making this proclamation after hearing story after story of families losing loved ones through gaps in Arizona's mental health care system. Today, she addressed several mothers as part of a group called the Mad Moms, including Crystal Fox, whose son, Joshua Fox, died by suicide last month in prison. His mom told the I-Team's Erica Stapleton that his death is a failure of the mental health system after the family struggled to get him help. This year, Senator Miranda hopes to help introduce legislation that could help families like Josh's. And joining me now for the backstory is 12 News investigative journalist Erica Stapleton, who's covered Josh's story last week. Erica, what happened before Josh's death?
Well, Tram, Josh's story is really sad, so I do want to warn our viewers that there is some sensitive material we're going to be talking about right now. But according to Josh's mom, she said in his late teens he was diagnosed with schizophrenia. He had some delusions, he was going through psychosis, and they took him to hospitals, they took him to care facilities, but they were ultimately turned away. And what happened after is that Josh wound up killing his father. It was really sad. He was taken to jail. Eventually, he was put on some medications that were helpful, but by that time he's already in the system, and he was sentenced to prison in the middle of December, and he was eventually taken there just before Christmas. But within 2 days, he wound up hanging himself in his cell, and he died a few days later at the hospital. So incredibly sad. And his mom is demanding for change, not just her, but she and that other Mad Mom group, as we were discussing. You know, it's a lot of families that are going through something like this. And now, again, they're demanding change, and they're looking at lawmakers to help them. And now they have the ear of one who's willing to try and push forward some legislation.
Yeah, that is so incredibly shocking. Now, of course, a lot of this is anecdotal. How is it possible, though, that so many people with mental illness, they're not getting the help that they need?
You know, a lot of this is anecdotal. You're right. We hear from family after family saying there's not enough long-term beds, and the facilities don't have much oversight. There's not a lot of resources that are actually helping their loved ones. And what we see are bad outcomes sometimes. People wind up on the streets, they wind up incarcerated, and they could be a danger to themselves, and they could be a danger to others. So what we're looking at is, are these services really helping? And Access actually put out a report last year. It was the first time they published deaths of seriously mentally ill people who are receiving state benefits. And in 2022, more than 1,700 people died. Now, some of those are natural deaths, but others are homicides, suicides, and listed as accidental. So those should not be happening, especially when people are receiving services that should help them. So that's something we really want to continue investigating.
Yeah, I know there are more reports to come. Erica, thank you so much.